It is
Yeah.
so great to see you this morning. My name is Lawana Brown, and I am a program director for Regis College's Women's Health Nurse Practitioner online track. So it's been really a pleasure to have great conversations with some awesome nurses. It's been such a pleasure for me. And Andy Levinsky is the one who's been responsible for that. So I want you, because I could never introduce you. I've looked at some things regarding your career, and I'm like, you need to do your own introduction. So just give the audience an idea of who you are.
All right, I'll start with my name, of course, Jeanette Ives Erickson. And my title is Chief Nurse Emerita at the Massachusetts General Hospital. I was the chief nurse at MGH for 21 years. So I decided that in 2017, it was time to retire. Mm-hmm. And my boss said, "You're not retiring, you can step down, but we'd like you to stay on." And it became that other duties as assigned. And it's been an interesting few years for me. I'd say a few months after stepping down as the chief nurse, I was asked to go to the Nantucket Cottage Hospital, where I was the interim president of the hospital. So that was a lot of fun. I got to spend several beautiful months on Nantucket. And then I was asked by the governor and the mayor to work with people from the Mass General Red Sox home base program to open up the Boston Field Hospital at the beginning of this COVID crisis. Mm-hmm. And now I'm actually running a very large vaccination center.
Wow, that's amazing. Yeah, and I was thinking when they say retirement, I can't, looking at your career and different things that have been said about you, I'm like, there's no way that there's an actual retirement for her. Maybe a different role, but not a retirement. I've heard you described as, an innovator, a transformational leader, a nurse's advocate, a patient advocate. So, but first and always a nurse is what everybody says, which is really great. So if you will rewind maybe a little bit for us to when did you decide you wanted to be a nurse, and what was your pathway like education wise for nursing?
Happy to share all of that very long and continuous journey, which I still think is so important. I actually thought I wanted to be a psychiatrist.
Oh, wow.
And it wasn't until like the end of my junior year or beginning of my senior year in high school that I had this wonderful conversation with a neighbor who was a nurse. And listening to her story, I thought, I'm going to nursing school.
Wow.
So I was introduced to this spectacular woman who became a lifelong mentor, Sister Consuela, a sister of mercy, who just made me realize that nursing was what I wanted to do. And so I went to, at the time, a diploma program, Mercy Hospital School of Nursing. And it was a very innovative diploma program because all of our liberal arts courses were taken at St. Joseph's College. Mm-hmm. So when we graduated, we had a significant number of a pathway to getting a bachelor's degree. And so then off I went to get a bachelor's degree and then a master's degree at Boston University, and then my DNP at the Mass General Institute for Health Professions. But along that way, I was practicing. I first became a critical care nurse, and then a nurse director of two very big inpatient surgical units, and then began to be tapped to do different things in the hospital that I was working at, which was Mercy Hospital in Portland, Maine. I was asked to do some process improvement work in our admitting department to make it more patient focused. And then I was asked to design an obstetrical unit. which was a labor delivery recovery and postpartum unit, one of the first LDRPs in the country, which was just wonderful.
Yeah.
And then while I was working, I decided, you better go get a master's degree. And so drove myself to Boston at the encouragement of Sister Consuela. She said, you should go to talk to Muriel Poulin, if that name should ring a bell with the students, and had a wonderful meeting with Muriel Poulin, who looked at my resume and said, come with me. And before I knew it, I was in the registrar's office, and she said, register her for classes that start next week.
Wow, how about that?
It was a very exciting time to meet Muriel Poulin, because she was just publishing with other researchers the book on magnet hospitals. That's when the magnet study was done. And so to have this wonderful nurse, now my teacher and the dean of my school, who was just studying what makes hospitals work and what attracts nurses to not only sign up for an organization, but also to stay within a healthcare organization. So my entire career is the way I approach management and leadership was through the lens of Muriel Poulin, who could tell you what was working and what wasn't working in nursing and in healthcare around the country. So I had these two wonderful women mentors, which
that is amazing.
Right. Yeah. So Sister Consuela constantly pushing me, go back to school, go back to school, and very driven by patients, very much driven by what I would say is ensuring the integrity of the nurse-patient relationship. And so that was quite wonderful. And then I had Muriel Poulin, who understood executive nursing practice and best practices in hospitals. So it was a wonderful time. I was driving back and forth from Portland, Maine to Boston University, because I still needed to work like everybody else, right? And but after I graduated, I had all these new wonderful classmates who now became friends, and they were all working in Boston teaching hospitals. And I thought, I'm going to Boston.
Oh, how amazing.
So, I took myself to Nash General in 1988.
Okay.
And was what we called at the time a staff specialist. And again, one of those other duties as assigned, but mostly to develop a leadership development program for all of the clinical leaders in the Department of Nursing at MGH. Then eventually became a nursing director, then was tapped to be the interim chief nurse when the chief nurse left the organization, and then the rest is history. As became the chief nurse in 1996.
That is amazing. What a story. I love the mentorship piece, because so often we hear about nurses, there's that old adage of nurses eating the young, but, I've seen a lot of mentoring in my own career. I was an old labor and delivery nurse. And so it was the older nurses, even, LPN nurses that had been in labor for a long time that, taught me a lot and mentored you. So it's wonderful. I also love the piece with Sister Consuela. I had read some about her. And of course, with us at Regis, the Sisters of St. Joseph's founded Regis College. So we have that care of the dear neighbor that's there, that's, always evident with the sisters. Such a wonderful legacy. And to know that you had a personal mentor, that must have been a really, really an awesome thing for you. Coming into COVID, kind of take us back to the beginnings of Boston Hope, and thinking about having stepped back a little bit, but now here comes COVID, and it evolved into something I don't think any of us could have really fathomed. But kind of take us through what that whole process was like with Boston Hope.
So it's interesting. I suspect you're the same, and I suspect the students are the same. When COVID arrived and was rampant in our communities, I mean, we were all sheltered in. If you weren't at the bedside taking care of patients, I felt like I was on the sidelines.
Yeah,
right?
me too.
I zooming away, right?
Mm-hmm.
Teaching some classes, doing some mentoring, writing, but it wasn't meaningful, right? You wanted, not that being with other nurses or other people wasn't meaningful, but who we are as nurses, I wanted to jump in.
Exactly.
And, I'm no longer clinically competent, so nobody was going to hire me to be a clinical nurse at this time. And so I made it known to many people that if there was an opportunity for me to help in any way, whether it was teaching people how to don and doff, or how to, I was going to even volunteer to help to screen patients in the lobby of the Mass General. And I realized one morning that I had missed a phone call from the then hospital president, Peter Slavin, which he had called me around 10:30 the night before, which would be very unusual for him to call me that late. And so 5 o'clock in the morning, I sent him a text saying, "Sorry, I missed your call. Is everything okay?" My phone rang in 2 seconds.
Wow.
And he said, "So I'm calling on behalf of the governor and the mayor."
Okay.
Okay, we want you to be the co-leader of this team that the governor is pulling together. And we want you to go and open up the field hospital. So at 5 o'clock in the morning, I realized that my very dear colleague, Brigadier General Jack Hammond, was going to be the partner in crime.
Okay.
Brigadier General Jack Hammond heads the home base program, which is a wonderful program to help Iraq and Afghan veterans return into society, dealing with any of the issues of being in war. And so to have Jack as my partner was just a gift. And we found ourselves that morning in the middle of the Boston Convention Center, which is a huge exhibition hall, is huge, but it's all concrete, saying, "This is going to be the field hospital. How is this going to work?" So the next day we brought in teams of people, of course, infectious disease people, people that engineers that understood air handling units. Suffolk Construction was brought in. And we started working on especially the air handling system, because it was going to be a COVID positive hospital, caring for patients, pulling patients out of all of the Northeast region of Massachusetts, all those patients that couldn't go home, but no longer needed intensive care.
Right.
And so we began working with the experts, and you'll love this, as only healthcare workers can do. The place was built in 4 days.
Yes. Oh my goodness. Yes. All hands on deck.
All hands on deck. Suffolk Construction, bless them, worked around the clock.
Wow.
Just constant. And so we had this 1,000-bed field hospital that a section of it were to take care of the COVID positive homeless people, the unsheltered people in our community. They didn't need health care, but they need to be protected, right? Just to make certain that they who were COVID positive, if they got sick, could come into the hospital part of what we call Boston Hope, the field hospital. So we had two sections, one which was protecting our unsheltered citizens, and then the other section, which was to take care of COVID positive people and to restore health and well-being, most of them with mobility issues, major mobility issues, and in breathing, of course, challenges. So lots of physical therapy, lots of nursing education, and lots of important time to, I would say, restore the human soul. And we, because people were just, the staff were devastated by what was happening in our community and in our world. And of course, the patients hadn't seen their families forever. And of course, they all thought they were going to die from this horrible new virus. So we had wonderful chaplains join us. We had mental health practitioners meeting with patients. But one of the best things that we did was we introduced music therapy.
Oh my.
To the environment, which patients started singing, which was also a good physical therapy rehab.
Exactly.
Right? So that was good. But all of a sudden there was this wonderful healing environment that was created.
Wow.
You know, because everybody is like covered day in and day out. You know, skin breaking down. The poor nurses in particular just had cuts all over their faces, and it was warm and very long days of caring for this wonderful population. But we had 1,000 people come to work at Boston Hope.
Oof.
These were from places that were no longer doing, you know, ambulatory visits, surgery. I had nurses from around the country emailing me saying, here you're hiring. When can I start?
Wow.
You know, lots of former colleagues, friends saying, I'm all in. And within days, we had hired 1,000 people. So we opened up Boston Hope within 8 days, and then gradually started introducing these programs into this concrete hospital. But it was just great. Lots of support from community leaders, people sending patients clothes because they knew the clothes had been thrown out. Right at the hospital. And we had shoes being delivered, lots of sneakers, sweatshirts, gym pants, so the patients could work out. And it was fabulous. We had a few hundred iPads donated, so patients could call home.
Ooh, that's amazing. I mean,
right. I say it was an experience of a lifetime.
Yes.
Right. I mean, I had a wonderful career as a nurse, but to think about how do you come together with a community and in 8 days start taking care of some of the most disadvantaged people in our community, right?
That is amazing. I mean, just hearing about it just, you know, gives me chills to think about all the different groups coming together, because we know that everybody in healthcare, we have that mentality of what can I do? Show me. I often tell people as a nurse, I take direction very well. Just tell me what to do. So to see all of that, and I know that you were actually, you know, the perfect person to be there, having managed, you know, and having the leadership that you've done over the years to be able to bring together all these different disciplines in one place. That was amazing. And I love the music therapy. You know, it makes me think, because I know you and I both know that now the nurses that are here on the other side of this, you know, we're on the other side of vaccination, but still in a very big wave here with Delta, that I think about what they're going to be like when this is over in a sense, because there's so much stress that they're dealing with that's different. I mean, I worked in a small hospital in labor and delivery. We had 116 beds, and I talked to a colleague there recently, and she said they had actually had to pull nurses out of the offices to come to the units because they were that stretched. And so, to think about what kind of management, but to think about music therapy makes me think that we should even be using some of that in the hospitals, so.
So let me continue if you'd like
Please,
to talk about music therapy.
Sure. Mm-hmm.
So we did recognize the impact that this music had on the staff as well as the patients. So we actually, as the field hospital started to close, we thought, how do we use what we learned about music therapy to help, to your point, in the hospital? So one of the physicians that we worked with, Dr. Ron Hirschberg, who also works with home base, but also works in the intensive care units at the Mass General, sat with a group of nurses and a writer. And the nurses started telling their stories. This was on a medical surgical ICU at the Mass General. And the writer came back with this song, "The Tears Are Flowing Now," describing the impact on these nurses from seeing all of these incredibly ill patients. And so then a musician put their words to music.
Wow.
I started partnering with Ron and the writer and the musician and said, well, if this is a good thing at the Mass General, why isn't this a good thing elsewhere? So I reached out to several of my chief nurse colleagues around the country, in particular, nurse leaders that I had talked with as I'm on the Magnet Commission.
Okay.
And so started reaching out to these chief nurses. And there are now over a dozen songs that have been produced across the country. And they're called frontline songs.
Okay.
And so these nurses are all describing the sitting with these writers and these musicians as incredibly healing.
Wow.
And so we are trying now to raise some funds to make this not a burden on hospitals, but how do we start paying more and more musicians to join us and to spread this across the country? So we're pivoting into developing this business model, but not to make a profit, certainly.
Yes, but to help.
To certainly, and to help. The other part of this that happened is that at Boston Hope, we had musicians volunteering to come in. And so we had Yo-Yo Ma as an example.
Oh, okay. Listen, okay now. That's
okay.
All right.
And
yeah.
so
we're on a different level when we talk about Yo-Yo.
So we had these wonderful musicians, some of them clinicians, volunteering. And so we said, okay, if this is healing in this environment, what about in all these vaccination centers where people are scared to death to get vaccinated? So we started putting these musicians in the vaccination centers, and what a difference.
Wow.
Think about, you walk in and you're very nervous, right? New vaccines, new virus. You're going into a very large place for the most part with lots of people. You haven't been out of your house in over a year.
Exactly.
And so you're seeing everybody masks and PPE everywhere, and you're getting a vaccine that has just come out of all these clinical trials.
Right.
All of a sudden, we introduce music. The tone changed immediately. Patients were focused on the music. wondering who the musicians were,
Right.
thanking the musicians, asking questions about the music. And they were getting vaccinated and were just very, very calm. And so it continues. The music therapy, I was on with a group yesterday. The state of Maine, my home state, is being devastated with COVID right now. And so we're talking about how do we move out of Massachusetts and into Maine to help them with their healing journey as well.
Yeah, we definitely would want to know more about that. And as you're talking, I'm thinking about, even with us here locally, we have, I work also for the University of South Carolina, and we have, multiple orchestras, and I'm thinking, we're doing vaccinations in some places in the health department parking lot. How hard would it be to put the orchestra on the steps with these students and have them play? Because they're doing outdoor concerts anyway because of, oh my, what an innovative, that would be amazing. So such an amazing thing to come out of that. And it sounds like that's going to be something that's going to continue, which is awesome. In talking about vaccination, here in my home state of South Carolina, we've struggled. We probably have about 40% vaccination rate, which is far from where we need to be. Just a constant fight against disinformation and some of the things on social media. But I know that you all have had a lot more success there where you are in Boston. Can you talk to us about some of the things that you think have been successful in getting your rates where they are and what we can do at this point?
Well, we probably don't want to turn this into a political event, but it is somewhat political.
Yes, it is.
We have a governor here in Massachusetts who followed the science.
Right.
And went out and about throughout the state encouraging people to get vaccinated. And when we think about the states with low vaccination rates,
exactly,
lots of it goes back to the governors saying, not necessary, masks not necessary, get vaccinated if you want.
Right. This is so true.
Versus leading. All of this conversation comes back to leadership, right?
Exactly. You're exactly right. It does.
And I'm not talking management. I'm talking about leading, having a vision, being one with each other. We are all in this together. Needs to be the leadership mantra. It's not you take care of this group, you take care of this group, and the heck with this group. We are all in this together. And until we all behave that way, we're never going to get out of this.
This is true. You're right. We've become our neighbor's keeper in the literal sense. And so until we accept that responsibility and, even here, like I say, there's a political side to the whole vaccine mask issue. But what I've told patients, because I work in a college health clinic, and, the students, of course, are eager to be vaccinated. But the things I try to tell them as far as parents is just to keep in mind that, I'm not taking away your right to do what you want to do, but you must do something. So if you're not going to vaccinate, wear your mask 100%. If you're not going to wear your mask, stay home. We need you to do something. We need everybody to be doing something to move us towards a healthier, because if not, we're going to be, back and forth like this for several more years,
I don't think people truly understand what a mask is for. I'm wearing a mask for you.
Yes.
Right? You're wearing a mask for me.
Exactly.
And so it's not about me. It's about me being a good citizen. I am doing it for you.
Exactly.
And nobody is taking my freedoms away.
No.
Right?
You're exactly
I'm doing this for you. And I think if we start to think that way, that if you're not doing it for me and I'm not doing it for you, we really aren't good citizens.
Exactly.
We really are not good citizens.
That is true. That is true. Is your vaccination center that you have there, is it a mass center, or are you all seeing still large volumes of patients that are coming through?
So because Massachusetts has a high vaccination rate, the volume is coming down. And at
Right.
first I was discouraged. And then I thought, no, Jeanette,
yeah, this is good.
No, this is a good thing, right? We were vaccinating like 1,500 people a day. And now the most is like 100. So we're still doing some of the unvaccinated, dose 1s and dose 2s. But now we're doing the third dose for the immune compromised citizens. And it's very interesting how grateful the immune compromised are, because they have been incredibly worried, especially when the research started coming out saying they probably don't have much protection.
Exactly. Yeah. So it's good that they're able to have that. This is such a great conversation. I mean, I could talk with you for days and not be able to touch on all the things that you have to offer to students, to nurses. And I do want to ask you though, when you think about the chief nurse, I think about the fact that you're at a table where you have, physicians, you have CEOs that are there, chiefs of administration. So how are you able, I know you have the poise for sure, because I can see all of that, but how are you able to be heard at a table where there's so many voices that are there, and at a table where nurses haven't always been invited to have a voice?
So a couple of things. I think the major role, there are two roles for a chief nurse. We'll just boil it right down, right? One is to represent the clinical discipline of nursing, right? You are the leader, just like the chief of surgery is the surgical leader. The chief of emergency medicine is the leader of that. And I don't think nurse leaders always think of themselves as the leader of the discipline, the largest clinical discipline, nursing. The second, to your point, is to represent nursing at what I sometimes call the business table.
Exactly.
Right. And so you not only have to have this discipline specific, but you also have to understand the business of healthcare. And whether it's the finances, process improvement, COVID, right? You have to bring those two things together. And depending on which meeting you're at, could be you're in a budget meeting, so this one's a little bit more forefront. You could be in a clinical meeting looking at how to improve care, a quality and safety meeting. You're leading the discipline. And so you have to always be a nurse, always be a nurse.
Wow.
But you also have to have these other skills. I decided when I was asked to be the leader of nursing that first and foremost, I needed to have the title of chief. And at the time it's common now. It was not common, but all of the physician leaders were called chiefs.
Exactly.
Nurses were called general directors, executive directors. I said, I'm the chief nurse. I'm leading the discipline just like my physician colleagues are.
Exactly.
I also knew that there is what is most hospitals have general executive committees where all of the clinical leaders and the business leaders come together to update each other, sort of the state of the union. So at Mass General, those meetings happened, general executive and chiefs meeting happened weekly. So I knew for my very first meeting, I needed to sit at the table, not in the back row.
Exactly.
And so I got to the meeting 15 minutes early.
There you go.
Marked my spot. And that became Jeanette's chair forevermore. The first time I was on vacation and wasn't at the meeting, chiefs were emailing me saying, "Where are you? Your chair is empty."
There you go. That's how you. Nobody said that is amazing. Oh, I love that.
Well, you have to think. So the point of this is you have to think strategically, right? You have to come into these meetings as a nurse.
Right.
Being a nurse is at the very core of my existence.
Right.
And so you take that with you wherever you are.
Right, exactly. Wow, that is amazing. I love that you were able to, not only did they give you a space, but you created the space for yourself and brought a
Right.
voice to that. And that's what we want our students to carry away. I think sometimes in nursing, we're good with the clinical side, but we're not really as clear on the business side sometimes. And that, even as a nurse practitioner, that is something that I found that I work on, because I need to understand, patient reimbursement, all these different factors.
Correct.
Because that plays into what I can do for my patient, and who I can see, all of those different things. So that's something we definitely want to pass on to the students and to nurses in general, because it's nurses like you that have made the profession more of what we envision it to be,
Correct.
Yeah, more of what we envision it to be.
And if we think about, to your point, if we think about being nurses, we're not like on a clock.
Right.
We're nurses everywhere we go.
Yes.
People are looking at us for advice now more than ever.
Oh, yes. Yes.
I was in a fellowship program several years ago from the Robert Wood Johnson Foundation. And one of the faculty members asked people about how many hours a day they were working. And, it was 10 hours, 12 hours, 14 hours, 16 hours. Everybody was working crazy hours.
Mm-hmm.
And the faculty person said to me, Jeanette, you're not answering. And I said, well, I'm struggling with the question. And he said, why? And I said, I'm with all of my waking hours.
Mm-hmm.
I'm a nurse. I'm a nurse leader.
Mm-hmm.
Many of my friends are nurses, so we're talking nursing.
Yes.
My family call me all the time, asking
Exactly.
for nursing opinions. I said, wherever we go, we're nurses. So how do you say you're working? You're not.
Yeah.
You're a nurse, no matter what. And so I think that's an important thing for your students to always remember, wherever they are, people are viewing them as professionals, which is wonderful, right?
Exactly.
Absolutely wonderful. Doesn't mean you have to be on the clock.
Right.
Because we need to take care of ourselves. There needs to be a sense of well-being, but we are representing the profession all the time.
Yes, that's exactly true. And we do try to emphasize that to students. We have come from an age where there wasn't as much social media presence as there is now. But I always, even when I taught undergrad, I would say, listen, remember, everything you post, every place you are, every picture, you're a nurse. And some patient could be seeing you on this particular blog or wherever you are. And you always have to remember that it's not just you, it's nurses in general. So
Correct.
yeah, we have to keep that in mind. I think back to, the nurse that we all think about, which is Florence Nightingale. And I know one of the quotes that she made that I read recently was how very little can be done under the spirit of fear. And I think about the time we're in now and how fearless nurses have had to be.
Right.
We've never had a time when you're working in the ICU or the unit, the frontline nurses that are afraid for themselves, for the patient, for their families, for everyone. But to move past that is the beauty of what's happened with nurses. And I want to thank you so much. One thing I love about these conversations is that I've gotten to know so many different sides of nurses, so many innovative nurses, and nurses like you. You make me think about a quote I read about a true leader. And it says that a leader knows the way, shows the way, and goes the way. And I think and know that you have done all of that. And that is just amazing. And we really hope that the students who see this will see that there's a lot more to be done than what we do in actual patient care, which is our hallmark. But we also need to be concerned about the profession, nurse leadership, the representation, and the things that you bring to us. So I thank you so much. I'll be smiling the rest of the day thinking about all the things, because it just makes me full to think about all the things, that you embody.
Well, I'm thrilled to meet you. I can feel your true spirit. You're a proud nurse. You're a proud faculty member, and I feel fortunate that you are a member of our community here in Massachusetts, but
Yes.
bigger, our nurse community. And so one day when we're out of this,
Yes.
I would love to get to meet you.
Oh,
And
yes, one day.
even see your students in
Yeah, I
person.
do plan to get to Massachusetts when we're out of all of this
Yeah.
and have that opportunity. And I definitely will make sure that I get a chance to connect with you at that time. But thank you so much. We certainly wish you well in everything that you have going on. There's no retirement. You're going to be a nurse. It's just, there's no retirement, but you're going to continue to do the things that you're doing.
Right.
And of course, the city and the state there where you are definitely very, very fortunate to have you there. And we appreciate you so much.
I want you all to stay well.
We will. And you do the same. Take
good
care.
Bye.
Bye-bye.